Number 4, the statistics released by the Ministry of Health on the number of persons infected so far has come mainly from testing of persons in quarantine and their known contacts. The testing process at the moment is slow and limited. We are working with the World Health Organization and Africa Center for Disease Control on the approval of rapid diagnostic kits produced by international and local institutions, including KEMRI, to scale up our testing. I did speak to the director of KEMRI yesterday, and they confirmed to me that in a couple of weeks, they will be ready with their kits for mass testing. Once approved, these diagnostic kits will enable the government to carry out mass testing of Kenyans, which is necessary to capture all those infected by the virus for isolation, containment, and management. This exercise is critical for us to adequately and comprehensively respond and manage this pandemic. We are working with international partners, including the World Bank and the private sector, on the acquisition of additional ventilators, sanitizers, and masks, with the aim of enhancing our capabilities and preparedness. Kenya Bureau of Standards has provided standards for production of these items, and local manufacturers should produce what they can en masse without any further delay. We are also scaling up oxygen supply to all the 94 hospitals that were identified under the MES program for use by patients who may need supplementary oxygen. This crisis has completely disrupted our lives and taken away everything we took for granted. Normal is a word we have to rapidly unlearn and hopefully relearn in future after the coronavirus. Yet, if we think that our lives have been disrupted, the world of healthcare workers has been turned upside down, inside out. More than anyone else, this crisis demands that frontline health workers give not just their best, but that they give their all continuously. They have to be away from their families so that we may be with ours. They have to come into close contact with the infected persons so that we may remain safe. While all of us are soldiers in this great army against COVID-19, our generals, crack unit, elite fighters at the front line are our healthcare professionals. To ensure that our community health workers, nurses, clinical officers, paramedics, laboratory technicians, pharmacists, and doctors perform their duties without them being compromised, personal protective gear is being made available and in adequate quantities to ensure sustained supply of these personal protective equipments. Local manufacturing capacity has been identified and contracted. To assist our healthcare workers who have demonstrated inspiring selflessness and diligence under extreme, stressful, and challenging conditions, let us rigorously observe the protocols set out by the Ministry of Health so as not to overburden them with unnecessary and avoidable incidences of infection. Let us also remember them and their families in our daily prayers and in every other way that we can. As His Excellency the President directed, our Treasury team is working with the legislature to realign our budget to make resources available for various interventions in combating the pandemic. Provisions of water, especially in our towns and particularly in informal settlements, will be a key consideration.